Cupping therapy is very effective for a number of conditions. Traditionally, it was used for a wind condition in the body, which in traditional cultures that meant what the wind brought with it in changes of weather was often a cold temperature, although in subtropical places it can also be a warm wind. It's the bacteria that is being transmitted through the movement of the wind that would enter the body. So this would demonstrate as a symptom of the cold and flu, conditions of the lungs, bronchitis, chronic cough, asthma, shortness of breath. So then we move into, from the shortness of breath and the asthma, it's also very effective for working on the diaphragm. Because cupping is lifting and creating space, it also helps create space in the lungs and in the diaphragm so that people suffering from congested conditions get a little bit more movement. Then we also look at treating the sinuses, the same thing. It's creating space, it's lifting, and it's moving the sinuses. So in this way, it's also very effective for lung and cold type conditions. The next major kind of traditional use of cupping is for pain. So it's very effective in muscular pain and injury, tendon pain and injury, and also issues with the fascia in the body. And again, one of the things that cupping is doing is it's helping to line up or remove adhesions in the tissues so that more blood flow can go to that area and the healing process can continue. And in a similar vein, cupping is very effective for treating scar tissue. So when the body lays down the collagen fiber for scar tissue, it lays down in a very random fashion. So when we apply cupping therapy to the scars, we're lining up all of that collagen fiber so that the blood flow improves in the area. Sometimes there can be also some nerve entrapment that happens with scar tissue. So when we relieve those adhesions, then we also get a better nerve response in the area. So the adhesions start to move in the same direction as the muscle fiber. Also, cupping is very effective in the abdominal area for a number of different digestive and women's gynocological issues. In the digestion, we can move the cups in the direction of peristalsis, and this can really help improve peristalsis. Over time, it can help the increase of gastric juices, enzymes, and hormone releases in the gut. It can also relieve blockages in the gut and in the intestines and improve the overall function of the organs by drawing more blood and settling down the nervous system. So we talk a lot about stress and the function of stress in the body. Well, the effect of stress is the fight or flight or stress response is that our blood rushes to our limbs and our brains in order for us to have a very quick response to whatever the stressor is in our lives. So obviously, a long time ago when we were hunting and gathering, it was very important for us to be able to have that very quick response. Now in today's society, we have different kinds of stressors, but the body still has the same reaction. So what happens is the blood goes out to the limbs and the brain, and it leaves the organs. So many of us in a stress state are really depriving our organs of the blood and the nourishment that they need to function properly. So when we perform cupping on the abdomen, we're drawing the blood back to the center of the body, helping the parasympathetic, which is the rest and repair, come back into the body, and also helping to nourish the organs with more blood. So this is another way that cupping is very helpful for the internal organs and the digestive system. And the same can be said for the reproductive system. When we draw more blood flow into the local areas and the circulation is improved, then a lot of symptoms, premenstrual symptoms, and gynecological problems are resolved simply from this increase in circulation in the area. So often you will see women with conditions such as endometriosis or ovarian conditions improving a lot, and even potentially maybe having a little bit of a treatment effect, like shedding a lot of old, dark, stale blood after they have treatment. So again, we have to be a little bit careful with our scope of practice here to make sure that we're not overstepping our professional boundaries.